Welcome back to Jersey Matters. The pandemic wreaked havoc on New Jersey nursing homes, but now they have a new problem. They don't have enough workers. Here's my interview with Andy Aronson, CEO of the Healthcare Association of New Jersey. Thank you, sir, for joining us again. The last time we spoke, you were unquestionably down because things were dismal, I think that's the right word, at nursing homes and long care facilities. Have things gotten better?
Yeah, Larry, unquestionably, things are better than they were in our facilities. The use of the vaccines, over 90% of our residents in our facilities are vaccinated. Over 80% of the staff in our facilities are vaccinated. The vaccines have proven to be very effective in keeping the rates of infection low in our facilities and certainly preventing the serious illness and the hospitalization and the death of our residents. So that's been good news. And our facilities just continue to get better at dealing with COVID. So unquestionably, our residents are doing better.
I think the last time we spoke, though, we were talking about the finances and the fact that some long care facilities were struggling and many had a difficulty finding workers. Is that improved?
So it's still a huge problem. Obviously, COVID has had a big impact on the finances of our facilities. Our census rates in our facilities are going back up a little more slowly than we would like, obviously, but they are ticking back up. Finding workers has proven to be a very big challenge. We lost a lot of workers during this pandemic. Long-term care was hit harder than any other sector of the healthcare market. And we continue that to be a challenge with the new vaccine mandates that just came out from the federal government. We will lose some workers in our facilities, and at a time where we have a shortage to begin with, that will cause a problem for us.
Yeah, I saw a report that was out that said nursing homes were down 221,000 jobs since the start of the pandemic. You're nodding your head in agreement.
Yes. Well, part of that is the loss in census in our facilities. So obviously when census goes down, there are less residents and less workers, but too big a part of that number is the fact that we just can't find workers to work in the facilities. Remember, long-term care is financed primarily through Medicare and Medicaid. That's how most of our residents are paid. We do not have the ability to just raise our rates or charge more and pay workers more. So what's basically happened is we have to pay our workers more to work in our facilities. The rates of pay have gone up tremendously since the beginning of this pandemic. In order to attract those workers. And because of just the way the market is, it's very, very hard to attract those workers.
Have nursing homes and long care term facilities, have they had to close? Have you had some that have just closed up shop?
So we haven't had many closures in New Jersey. I think you've seen some closures across the country. As this goes on, I think you're likely to see some facilities close, but I don't think that's going to be a big problem in New Jersey. I think what you're seeing more than a facility closure is you're just seeing facilities operating at a lower census level than they used to. They can't bring in more residents because they don't have the staffing to take care of the residents. And I think that's the bigger impact on facilities right now.
Have you seen that problem already? I mean, have there been people that have been turned away?
Yeah, that's happening all throughout our state. It's created a problem for the facilities, obviously, because you can't fill up, you can't operate an appropriate census. It also creates a problem, obviously, for people that need the care, because eventually that will create an access problem for people.
Oh, if it continues to grow, that's a serious healthcare problem,
Yes.
Especially for the elderly in the state. Who do you look to for help with that?
Well, we obviously have to look to funding sources. We have to look to government. We have to look to the state for Medicaid funding, and we have to look to the federal government for Medicare funding and relief. We need to be given the ability to pay our workers more. And as we have the ability to pay our workers more, to compete for nurses, for example, with hospital systems that get to pay the nurses a little bit more than nursing homes do, we need to be able to compete for those workers in order to fully staff the facilities and then provide, obviously, enough beds for the people that need them.
It's almost, and excuse me for if I'm not being articulate with this, but it's almost a nice problem to have, because I was thinking that you might have a problem getting people to come to your facilities because of the negative publicity, much of it no fault of your own. You were forced to take some people, but you might have a trouble of getting customers, that people would be staying home. That doesn't seem to be happening.
It's hard to say. That might be happening in some places. The nursing home industry did get a lot of negative publicity during the pandemic. I think people have learned over time and understood that nursing homes actually did an exceptional job taking care of people during this pandemic. And people in nursing homes right now are safer than people are in the general community. So I think that has largely not gone away. That's the wrong way to say it, but it's been reduced and people are willing to come into nursing homes now. Like I said, I think the biggest problem in raising our census is the staffing shortage at this point. That really is where we have to focus our efforts.
You have beds that are unfilled right now.
Absolutely.
You have beds that are unfilled.
Yes. Yeah. The occupancy rate in nursing homes in New Jersey is somewhere in the low 70s, about 72%.
Okay. Well, I hope for better days for you. And I've been saying this every time we speak because you are an important part of the healthcare system. And if this, and I'll ask you, instead of trying to speculate on my own, if this continues, what happens?
I don't expect it to continue indefinitely. Let's put it that way. I think what's going to happen is I think that policymakers in our state are aware of the problems. I think they're committed to working with us to fix the problems. And as you said, nursing homes are an essential piece of the healthcare continuum in New Jersey. We need these facilities in order to care for people who need this care. So ultimately, I think we're going to find solutions to the problem.
All right, then we'll talk again.
Fantastic.
I'd love to talk to you with better news. Thank you, sir.
Appreciate it. Thank you, Larry.
Andy Aronson, CEO of the New Jersey Healthcare Association. Still to come on Jersey Matters.
Global supply chain shortages continue to affect industries across the country. And here in New Jersey, a local soup kitchen is feeling the strain. More on that story next.